Hi, welcome to our Saving Money on Group Health Insurance Benefit series. Today I will be going over tip number 3, which is the difference between a PPO and a reference-based pricing health plan. So with that being said, let's get started. So in this video, we're going to go over what reference-based pricing is, the cost comparisons and savings from a reference-based pricing to a PPO, the coverage comparison to a PPO, and any exposures. Okay, so what is reference-based pricing? Reference-based pricing uses the Medicare fee schedule as a benchmark for claims payment. Most insurance companies are reimbursing right at about 140% of Medicare for hospital services and about 125% for physician services. Now, some of those can be higher, some could be lower, depends on the insurance company, but that's kind of the average of what the insurance companies are using. So on a reference-based pricing plan, doctors are not contracted with a network, so it allows the patient to go anywhere they want. They go to any doctor in any hospital that they want. They're not confined to a network. Reference-based pricing products also are only self-funded or level funded. They don't do those in the fully insured market. So let's take a look at the PPO network versus the reference-based pricing. The PPO has an in-network doctors and out-of-network doctors, and they also have two different levels of payment. They have an in-network deductible, co-insurance, and out-of-pocket, and they have an out-of-network deductible, co-insurance, and out-of-pocket. Where on a reference-based pricing plan, there's a single deductible and single co-insurance because you can use any doctor or hospital you'd like on the reference-based pricing product. Now, the PPO versus the reference-based pricing, this is a sample group of 29 employees. As you can see here, the PPO has a $3,000 deductible and an out-of-network deductible of $6,000. The out-of-network out-of-pocket on this one here is $10,000 with a $5,000 deductible. So essentially on this PPO plan, you can be out of pocket virtually $16,000 plus reasonable and customary charges, depending on the out-of-network providers you saw. So $16,000 a person out of pocket cost on this plan if you're using both in and out of network doctors and hospitals. So just remember there are both in-network and out-of-network deductibles. Now, in the reference-based pricing plan, there's a $3,000 deductible, excuse me, and a $5,000 out-of-pocket cost. So the maximum exposure on the reference-based pricing plan is $5,000. This one has single deductible, single co-insurance, very simple. Normally the co-insurance rates can be anywhere from 50 to 90% on the co-insurance, but the out-of-pocket cost is really what we look at because we want to know what the maximum exposure is if something happens that's catastrophic. So on the PPO, you are subject to reasonable and customary on out-of-network services, and you are subject to usual and reasonable and customary on the reference-based pricing plan also, but they do provide some assistance with the URC. URC stands for usual, reasonable, and customary, and if you need help with that, check out our video on usual, reasonable, and customary. Okay, so this group is a demographically older group that we've ran rates for. It has 29 employees, and keep in mind your rates may vary depending on your demographics, location, industry type, medical conditions, and plan design. So the cost for this particular plan on this group was, on the PPO, was $678 an employee, which is pretty high. So in my opinion, pretty high. But the group, like I said, they are an older group, so the rates were expected at the $678 rate. Now, the fully insured rates were much higher than this, so keep that in mind. But pretty decent plan design with a $3,000 deductible. But $678 on the employee rate. The spouse was $1,545, children $1,021, and the employee only at $1,888. Now, the reference-based pricing plan cost came in much less at $334 an employee, $757 for a spouse, and $508 for children, and $931 for a full family. So that actually ends up being a savings of 202% on the PPO versus the reference-based pricing product. So keep in mind, like I said, this is a demographically older group. So your rates will vary. Most of the time, we don't see this type of savings, not 202%. It could be anywhere from 15, 30%, 50 or 70, but this one actually ended up pretty high at 202. So keep that in mind when you're looking at reference-based pricing products. And if you need help, of course, you can always call us here at the general agency and we can go over that with you. So what you need to know about reference-based pricing: one, claims are paid on a Medicare benchmark. So there's no PPO network that you have to go to. We kind of went over that in the previous slide. The reference-based pricing plan, contracts are written as a level funded or a self-funded contract, which actually is good for the employer, because if there's any unused claim funds, those actually get refunded to the employer. So when you saw the savings for the reference-based pricing product, there could be additional savings on top of that depending on what the claims the claims are for that year. So utilization will matter. When you keep the claims low, the odds of the employer getting money back are pretty good. So keep that in mind. The plans are medically underwritten, so there are medical questions asked of the employees, and the patients can be subject to balance billing. So let's run over what you need to know about balance billing. Now, some carriers offer billing assistance with balance billing assistance. So if an employee gets a bill in the mail, all they have to do is send it over to the agent and forward it up to the insurance company, either or, and the insurance company will take that and start a negotiation process with the doctor or hospital or the provider, and start seeing if they can negotiate that bill down to the Medicare benchmark rate that they're paying. So they do claims auditing as well. They can also help with scheduling assistance. So if you have a scheduled surgery and you need to go see a doctor for a knee replacement, they can tell you who's competitive in that market. So they do have scheduling assistance. Provider location services, they can help you find doctors too if you need one. Just all you have to do is just call the number on the card and say, hey, I need help finding a doctor, and they can help you find somebody in your area. Now they also a lot of carriers offer legal services for a billing resolution. So when you get a bill in the mail, the first thing you need to do is send it over to the insurance company so they can negotiate the claim. What a lot of these billing companies have done in the past is they would actually ding your credit for it right away. They would automatically send it to collections. Some of the insurance companies we work with, what they do is they actually send a letter out to the provider or the billing service and say, hey, don't report this to our client. We're going through a claims negotiation right now, and so hold off on that. So they do send letters out for them. So keep in mind, education is important. Make sure that the employees know how to operate the plan. If you need help, of course, you can always call us here at the general agency. And if you like this video, remember to hit the like and subscribe button. And with that being said, my name is Howard Deal. I'm the owner of the general agency, and have a great day.